Hi everyone, this is Dr. Devon Barley with Greenwich Chiropractic, and in this video series we're talking a lot about shoulder pain. Now, here are 3 common signs and symptoms of shoulder pain in specific instances that may give you an idea of what the problem is. The first is if you move your shoulder around and you have good range of motion, you can sort of move it all the way, but you're hearing clicking, crackling, and popping. Sometimes this is a sign of crepitus or arthritis. It can also be a sign of a labral issue because the labrum is the cartilage covering that widens or deepens the cup. It sits on the top of the rim of the cup of the shoulder. And a tear in that or arthritis can cause this grinding, clicking, or popping sound that you're hearing in there. The other thing is that if you're feeling pain in the front, directly in the front, where you can basically touch it and it feels sharp, and even if you can still move your arm, but this motion, bringing your hand up to your bicep, your upper arm is tight, you may have some bicipital tendinitis. So that's tendinitis in the biceps tendon. And then of course, the last one, which is kind of a simple test that you can do on yourself. But if we think about any pain on the outside of the shoulder here, where it kind of goes from the back and kind of comes down to the side here, if you try to lift your arm, there's a few tests that we want to look for. The first is if you lift your arm all the way up and you can get it all the way up without any pain, that's a great sign. If you feel pain at the top, but you can get the arm all the way up, that could be a sign of an AC joint issue. If you have pain all the way through the motion or feel like you can only get to a certain point, that could be a rotator cuff issue or even adhesive capsulitis or frozen shoulder. And then a really positive sign of a tear is if you lift your arm out to the side after a while, it just feels like it's ready to drop. That could be a sign of a possible supraspinatus or a portion of the rotator cuff being torn. If any of these things are positive, we recommend getting seen by a healthcare professional so that you can get evaluated accurately. Thanks so much for listening. We'll see you on the next video.